Okay, today we're covering chapter 11 from your fitness textbook. And this chapter is cardiovascular diseases and diabetes. So, in this chapter, you'll learn about the major forms of cardiovascular diseases, CVD in short, which includes hypertension, atherosclerosis, and stroke, and also the factors that put people at risk for cardiovascular diseases. As the country's leading cause of death, CVD claims almost 660,000 American lives every year, largely due to our way of life. And we'll also talk about diabetes because it's a key CVD risk factor. Most important, you'll learn the steps you can take to protect your heart and promote cardiovascular health throughout your life. So, cardiovascular disease. This is a collective term and it includes the diseases that affect the heart and blood vessels, as you see in the picture. And these diseases include heart disease, heart attack, which is a blockage of a coronary artery, stroke, which is a blockage of a cerebral artery, and angina, chest pain, as well as blood vessel diseases, arrhythmias, heart rhythm problems, congenital heart defects, and other conditions affecting the heart muscle valves or rhythms. CVD is the leading cause of death in the United States with more than 2,200 deaths per year. Heart disease, particularly number one cause of death in the United States, claims one life in US every 40 seconds. Stroke is the number two cause, largely due to way of life. Being overweight and sedentary, smoking, alcohol use, eating unhealthy, um, if all major forms of cardiovascular diseases were eliminated, would increase life expectancy in US by almost 7 years. That's why it is that important. Hypertension, in other words, high blood pressure. This is resulted from an increased output of blood. So two mechanisms, as you see on the slide, by the heart as seen as the first mechanism, which is increased cardiac output, or from increased resistance to blood flow in the arteries. So either increased cardiac output, which is the amount of blood, and or the resistance to that blood flow. The resistance is resulted by constriction of the smooth muscles surrounding their arteries or by atherosclerosis. So atherosclerosis is causing that constriction. This is a disease. Atherosclerosis is a disease process that causes your arteries to become clogged and narrowed. High blood pressure also scars and hardens your arteries, making them less elastic and further increasing blood pressure. When a person has high blood pressure, the heart must work harder than normal to force that blood through the narrow and stiffened arteries, straining both the heart and the arteries. Eventually, the strained heart weakens and tends to enlarge, which weakens it even more. So, hypertension comes with almost no symptoms. That is why it is also called a silent killer. But it does damage organs, for example, kidneys, and increases the risk of heart attack, stroke, kidney failure, and blindness. Unfortunately, more than or about 53% of adult Americans have hypertension, and only about 27% of them have high blood pressure under control. The guidelines for blood pressure classification have been updated by the American Heart Association in 2017. As you can see, the normal blood pressure category is now less than 120 systolic and less than 80 for diastolic, as opposed to the previous criteria that considered 120 over 80 as healthy. Please note that risk of heart attack and stroke begins to rise when blood pressure is greater than 115 systolic and greater than 75 diastolic. So I have mentioned the atherosclerosis being the cause of high blood pressure. Now we're going to take a look at this atherosclerosis concept by itself. So the high blood pressure, we saw that in the previous slides, it is a result of either an increased output of the blood, which is the volume of blood by your heart, or the increased resistance to that blood flow in the arteries. The latter condition, which is the resistance from your arteries, can be caused by the constriction of smooth muscle surrounding the arteries or by atherosclerosis, a disease process that causes arteries to become clogged and narrowed. So the arteries narrowed by deposits of fat, cholesterol, and other substances. The deposit is called plaque. The process begins when endothelial cells are those cells lining your arteries, when they become damaged, most likely through a combination of factors such as smoking, high blood pressure, high insulin and sugar levels, and deposits of oxidized LDL particles. Atherosclerosis often begins in childhood with no symptoms. You will not know that you are developing atherosclerosis in your arteries. The coronary arteries, which are the arteries that supply excuse me, the heart with blood, are particularly susceptible to plaque buildup, a condition called coronary heart disease, CHD, or coronary artery disease, CAD. Both of them are interchangeable. So, the blockage of a coronary artery causes a heart attack. If a cerebral artery is blocked, the result would be a stroke. The main risk factors for atherosclerosis are, again, smoking, physical inactivity, high cholesterol levels, hypertension, and diabetes. Heart attack or myocardial infarction. When blood flow to the heart is severely reduced or blocked in a coronary artery, the heart is starved of oxygen and nutrients, a condition called ischemia. When part of the heart muscle, myocardium, is damaged or dies from ischemia, it is called heart attack or myocardial infarction. Heart attack symptoms may include pain or pressure in the chest, pain in the arm, neck, or jaw, difficulty breathing, excessive sweating, nausea and vomiting, and loss of consciousness. This is a figure 11.2 blood supply to the heart that is coming from your textbook. So heart attack in women is a little different than a regular heart attack. So we say not all heart attacks involve sharp chest pain. Women are more likely to have symptoms different than men, which include shortness of breath, weakness, unusual fatigue, cold sweats, dizziness, and weakness. Heart disease and heart attacks, if the symptoms of heart trouble occur, it is critical to contact an emergency medical service or go immediately to the nearest hospital. So you should be able to identify the symptoms either in your body or someone else's body by their body language. Many experts also suggest that the heart attack victim chew and swallow one adult aspirin tablet, which is 325 milligrams aspirin, as an immediate anti-clotting effect. If someone having a heart attack gets to the emergency department quickly enough, a clot dissolving agent can be injected to dissolve a clot in the coronary artery, reducing the amount of damage to the heart muscle. Now let's talk about the sudden cardiac death, which is also called cardiac arrest. If the electrical impulses that control heartbeat are disrupted, the heart may beat too quickly, too slowly, or in an irregular fashion, a condition known as arrhythmia. Sudden cardiac death, also called cardiac arrest, is most often caused by an arrhythmia called ventricular fibrillation, a kind of quivering of the ventricle that makes it ineffective in pumping blood. If ventricular fibrillation continues for more than a few minutes, it is generally fatal. Cardiac defibrillation, in which an electrical shock is delivered to the heart, can jolt the heart into a more efficient rhythm. This shock can be administered with an automated external defibrillator, or in short, AED, a first aid device that is available in many public places in case someone experiences a heart attack. Now, the stroke, which is the heart attack of your brain, cerebrovascular accident, or in short, CVA, which occurs when the blood supply to the brain is cut off. There are two major types of strokes, ischemic and hemorrhagic. An ischemic stroke is caused by a blockage in a blood vessel, just like a coronary artery being blocked and causing a heart attack. Here, cerebral artery is blocked by atherosclerosis, causing a stroke, which is called an ischemic stroke, which is the most common type and account for 87% of all strokes. A hemorrhagic stroke, which is bleeding in your brain, occurs when a blood vessel in the brain bursts, spilling blood into the surrounding tissue. Cells normally nourished by the vessel are deprived of blood and cannot function. In addition, accumulated blood from the burst vessel may put pressure on surrounding brain tissue, causing damage and even death. Next slide. If brain cells are deprived of blood more than a few minutes, they die. Once brain cells begin dying, about 2 million cells are lost every minute that blood flow is not restored. Nerve cells control sensation and most bodily movements depending on the area of the brain affected. A stroke may cause paralysis, walking disability, speech impairment, memory loss, and changes in behavior. Prompt treatment of stroke can greatly decrease the risk of permanent disability. So time is of essence here. You may see the stroke symptoms in the simple acronym B FAST. B for balance, E for eyes, F for face, A for arm weakness, S for speech difficulty, and T for time to call 911. I repeat, time is of essence when it comes to stroke, so you need to be able to identify the symptoms if you see them and call 911. Now, another cardiovascular disease is called congestive heart failure, or CHF in short. This is about the heart's pumping mechanism, which could be damaged by a number of conditions, including high blood pressure, heart attack, atherosclerosis, viral infections, rheumatic fever, and birth defects. When the heart cannot maintain its regular pumping rate and force, fluids begin to back up. When extra fluid seeps through capillary walls, the small arteries or veins, edema, in other words, swelling results, usually in the legs and ankles, but sometimes in other parts of the body as well. When fluid backs up, it might get collected in the lungs and interfere with breathing, particularly when a person is lying down. This condition is called pulmonary edema, and the entire process is known as CHF, congestive heart failure. Treatment includes reducing the workload on the heart, modifying your salt intake, and using drugs that help the body eliminate excess fluid. So we're going to now turn our focus from the diseases to the risk factors that could be controlled or changed and the risk factors that cannot be changed. So let's talk about the ones that we can change first and understand that we have some power over our choices. So the American Heart Association identified 6 major risk factors for CVD that can be changed. One is tobacco smoke. Other one is high blood pressure, unhealthy cholesterol levels, physical inactivity, obesity, and diabetes. We have already talked about the hypertension, so we will review the other factors in the next section. So the first one we're going to talk about is tobacco smoke. Nearly 1 in 5 deaths is attributable to smoking. More than 20% of adult men and about 15% of adult women smoke. Smoking remains one of the most preventable causes of CVD in the United States. When smokers have heart attacks, they are 2 to 3 times more likely than non-smokers to die from them. Cigarette smoking also doubles the risk of stroke. Smoking harms the cardiovascular system in several ways. By damaging the lining of arteries, by reducing the level of HDL, which is considered to be the good cholesterol, by raising the levels of triglycerides and the bad cholesterol, in other words, LDL, by increasing blood pressure and heart rate, by reducing the oxygen available to the body, by speeding the developing of fatty deposits in the arteries, and by causing platelets to stick together, leading to clotting. So we should stop smoking. The second risk factor that could be changed is unhealthy cholesterol levels. Cholesterol is carried in the blood by protein lipid packages called lipoproteins. LDL is known to be bad cholesterol because if there is more than the body can use, the excess can be deposited in the blood vessels. High density lipoproteins or HDLs, in other words, good cholesterol. You can remember this from the letter H representing healthy. HDL or good cholesterol act as scavengers and are transported in a protein package that takes the LDL, the bad cholesterol, back to the liver for recycling. By removing cholesterol from blood vessels, HDL helps protect against atherosclerosis. So, recommended blood cholesterol and lipid levels are shown here. Total cholesterol should be kept below 200 milligrams per deciliter of blood. LDL cholesterol is considered optimal when it's below 100 and near optimal when it's below 130 milligrams per deciliter of blood. HDL, being the good cholesterol, should at least be 60 milligrams per deciliter of blood to be considered as healthy. The more HDL you have, the better your health will be. Triglycerides, which are the fat molecules in your bloodstream, should be below 150 milligrams per deciliter of blood to be considered normal. Another aspect of cholesterol is lifestyle choices to help improve cholesterol levels include exercising regularly, limiting saturated fat intake, and trans fat intake, actually not limiting, but eliminating trans fat intake, and choosing a healthy dietary pattern. For lowering LDL, the ACC and AHA, American Heart Association, recommend a dietary pattern that is rich in fruits, veggies, and whole grains, includes low-fat dairy, poultry, fish, legumes, non-tropical vegetable oils and nuts, and limits sweets, sugar-sweetened beverages, and red meats. Treatment for elevated blood cholesterol levels include lifestyle change and therapy with statins. Another risk factor that can be changed is physical inactivity. An estimated 1 in 3 or a total of 40 to 60 million Americans are so sedentary that they're at high risk for developing cardiovascular disease. Exercise is thought to be the closest thing we have to a magic bullet against heart disease. It lowers cardiovascular disease risk by helping to decrease blood pressure and resting heart rate so that it reduces the workload on your heart. It increases HDL levels, which will clear LDL, which is the bad cholesterol. It maintains desirable weight. It improves the condition of blood vessels and prevents or controls diabetes. One study found that women who accumulated at least 3 hours of brisk walking each week cut their risk of heart attack and stroke by more than half. So that is huge. Okay, the other risk factor that can be changed is obesity. The risk of death from cardiovascular disease is 2 to 3 times higher in obese people. Obese people are defined as having a BMI greater than 30 than it is in lean people, which has BMI from 18.5 to 24.9. And for every 5-unit increment of BMI, a person's risk of death from coronary heart disease increases by 30%. So excess weight increases the strain on the heart by contributing to high blood pressure and high cholesterol. It can also lead to diabetes and other CVD risk factor. We're going to see it in the next section. Distribution of fat is also significant. So fat that collects in the abdomen, which is also defined as apple-shaped body, is more dangerous than fat that collects around hips, which is considered to be pear-shaped body. Obesity in general and abdominal obesity in particular is significantly associated with narrowing the coronary arteries even in young adults in their 20s. And the last risk factor that can be changed is diabetes. Diabetes mellitus is a disorder in which the metabolism of glucose is disrupted, causing a buildup of glucose in the bloodstream. People with diabetes are at increased risk for cardiovascular disease, partly because elevated blood glucose levels can damage the lining of arteries, making them more vulnerable to atherosclerosis. Diabetics also often have other risk factors, including hypertension, obesity, unhealthy cholesterol, and triglycerides levels, and platelet and blood coagulation abnormalities. Therefore, careful control of other risk factors is critical for people with diabetes. Even people whose diabetes is under control face an increased risk of cardiovascular diseases. There are two types of diabetes, type 1 and type 2. Type 1 diabetes is about 5 to 10% of people with diabetes have the more serious form known as type 1. The body's immune system, triggered by a viral infection or some other environmental factor, destroys the insulin-producing cells in the pancreas. Usually begins in childhood or adolescence and is not related to obesity. Type 2 diabetes is also called acquired or adult onset of diabetes. The remaining 90 to 95% of Americans with diabetes have this type 2 diabetes. The pancreas fails to produce enough insulin, cells are resistant to insulin, or both conditions occur. About 1/3 of people with type 2 diabetes must take insulin. Another type, which is not very common, is called gestational diabetes, which occurs during pregnancy, and only 2 to 10% of people who are pregnant will have this type of diabetes. And these people have up to 60% chance of developing diabetes within 10 to 20 years. Prediabetes is something that I really want to draw your attention to because there are so many people who are pre-diabetic and they are not aware of it. This term describes blood glucose levels that are higher than normal, but not high enough for a diagnosis of full-blown diabetes. Most people with the condition will develop type 2 diabetes unless they adopt preventative lifestyle measures. Factors involved in the development of type 2 diabetes are age, obesity, physical inactivity, family history, and lifestyle. Excessive body fat reduces cell sensitivity to insulin, and insulin resistance is usually a precursor to type 2 diabetes. Race and ethnicity also play a role, and people with pre-diabetes also face a significantly increased risk of cardiovascular diseases. So, what are the warning signs for diabetes? Be alert for these warning signs. Frequent urination might be signifying diabetes. Extreme hunger or thirst. Unexplained weight loss. Extreme fatigue, blurred vision, frequent urinations in infections, cuts and bruises that are slow to heal, tingling or numbness in the hands and feet or feet, generalized itching with no rash. So, how do we test and treat diabetes? Routine screening for diabetes is recommended for people over the age of 45 and anyone younger who is at high risk. It involves a blood test to check glucose levels after either a period of fasting or the administration of a set dose of glucose. There is no cure. Diabetes can be managed successfully by keeping blood sugar levels within safe limits through diet, exercise, and if necessary, medication. Even a small amount of exercise and weight loss can be beneficial. How do we prevent diabetes? Well, about 90% of cases of type 2 diabetes could be prevented. They are preventable if people adopted healthy lifestyle behaviors like regular physical activity, moderate diet, and modest weight loss has been shown to lower diabetes onset by nearly 60% if that weight loss is 5 to 7% of the body weight. For people with diabetes, lifestyle measures are more effective than medication. That's why we're covering this chapter. All other contributing risk factors that can be changed including high triglyceride levels, excess body fat, very high carbohydrate intake, physical inactivity, smoking, type 2 diabetes, and excess alcohol. So these are other risk factors that contribute to cardiovascular diseases and still could be changed. That's what we're going to be talking about now. Starting with high triglyceride levels. These are blood fats that are absorbed from food and manufactured by the body. High triglyceride levels are a reliable predictor of heart disease, especially if associated with other risk factors such as low HDL, obesity, or diabetes. Factors contributing to elevated triglyceride levels include excess body fat, physical inactivity, cigarette smoking, type 2 diabetes, excessive alcohol intake, very high carbohydrate diets, and certain diseases and medications. A full lipid profile should include testing and evaluation of triglyceride levels. For people with high triglyceride levels, lifestyle changes can bring levels down into the healthy range, losing weight, reducing intake of added sugars, while increasing intake of unsaturated fats and increasing physical activity. Limiting alcohol use is also helpful for some people with very high triglyceride levels. Drug therapy may be prescribed. Another contributing risk factor that can be changed is insulin resistance and metabolic syndrome. So that's a new concept we're going to cover, metabolic syndrome. They greatly increase cardiovascular disease risk, more so in women than in men. Insulin resistance refers to a condition in which muscles, fat, and liver become less sensitive to the effect of insulin as people gain weight and become less active. Those who have insulin resistance tend to have several other risk factors that are together called metabolic syndrome. To reduce risk, choose a healthy pattern, dietary pattern, and get plenty of aerobic exercise. Metabolic syndrome is a cluster of symptoms present in many overweight and obese people that greatly increases their risk of heart disease, diabetes, and other chronic illnesses. A person is diagnosed with metabolic syndrome if they have at least 3 out of the 5 key factors. And those key factors are 1, large waistline, fat deposits in the abdominal region, 2, high blood pressure, 3, high fasting blood sugar due to insulin resistance, 4, high triglycerides, and 5, low HDL, good cholesterol. And I want to draw your attention to how HDL plays a more significant factor than LDL. As you can see, LDL is not one of those 5 key factors. Having low HDL is. And if a person, I repeat, has just 3 out of the 5 risk factors listed here, is diagnosed with metabolic syndrome. So the characteristics of metabolic syndrome, the textbook lists 3 key factors with their associated values in table 11.3. So the large waistline we talked about is defined as 35 or more inches for women and 40 or more inches for men. High triglycerides are defined as 150 milligram per deciliter or higher, or taking medication to treat high triglycerides. Low HDL, or good cholesterol, is defined as less than 50 milligram deciliters for women and less than 40 milligram per deciliter for men, or taking medication to treat low HDL. High blood pressure is defined as 130/80 85 millimeter mercury or higher, one or more or both numbers, or taking medication to treat high blood pressure, high fasting blood sugar due to insulin resistance is defined as 100 milligram per deciliter or higher, or taking medication to treat high blood sugar. And again, it is noted that a person having 3 or more factors listed here is diagnosed with metabolic syndrome. Major risk factors that cannot be changed is our next focus. Multiple genes contribute to the development of CVD and its risk factors. The risk is modifiable by lifestyle factors. About 70% of people experiencing heart attack symptoms are age 65 or older. CVD is the leading killer of men and women, but men are more likely to have CVD earlier in life. Estrogen production may offer premenopausal women some protection against CVD. By age 75, the gender gap nearly disappears. Contributing risk factors that can be changed is inflammation. Inflammation plays a key role in the development of cardiovascular diseases. When an artery is injured by hypertension, smoking, cholesterol, or other factors, the body's response is to produce inflammation. A substance called C-reactive protein, CRP, is released into the bloodstream, and high levels of CRP indicate a substantially elevated risk of heart attack and stroke. Contributing risk factors that can be changed is psychological and social factors. Many of the psychological and social factors that influence other areas of wellness are also important risk factors for CVD. The cardiovascular system is affected by sudden, acute episodes of mental stress and the more chronic underlying emotions of anger, anxiety, and depression. Another contributing risk factor that can be changed is alcohol and drugs. Drinking too much alcohol raises blood pressure and can increase the risks of stroke and heart failure. Stimulant drugs, particularly cocaine, methamphetamines, and associated stimulants such as designer drugs like ecstasy, MDMA, can also cause serious cardiac problems, including heart attack, stroke, and sudden cardiac death. Injection drug use can cause heart infections and stroke. Major risk factors that can't be changed include ethnicity. African Americans have much higher rates of hypertension, heart disease, and stroke than other groups. American Indians and Alaska Natives have higher rates of hypertension than non-Hispanic whites. Hispanic women have higher rates of angina. Asian Americans have historically had lower rates of cardiovascular diseases. Major risk factors that can't be changed. Genetics. Multiple genes contribute to the development of CVD and its risk factors. Having an unfavorable set of genes increases your risk, but risk is modifiable by lifestyle factors. Age. About 70% of all heart attack victims are age 65 or older. For people over 55, the incidence of stroke more than doubles in each successive decade. Gender. Although CVD is the leading killer of both men and women in the United States, men face a greater risk of heart attack than women, especially earlier in life. Estrogen production may protect premenopausal women against CVD. By age 75, the gender gap nearly disappears. Protecting yourself against cardiovascular disease is our next focus. So what should we do? Eat a healthy, heart-healthy diet, limit saturated fat intake to 5 to 6% of your total daily calories. Trans fats should be avoided. A high fiber diet is associated with 40 to 50% reduction in the risk of heart attack and stroke. Focus on whole grains, fruits, and veggies. And to reduce blood pressure, reduce sodium intake and to no more than 2,300 milligrams per day, and increase potassium intake. Moderate alcohol use may increase HDL cholesterol and reduce stroke risk, but excessive alcohol use increases the risk of serious health problems, so it might not be worth it. How do we protect ourselves again against cardiovascular disease? Exercise regularly, avoid tobacco, know and manage your blood pressure, know and manage your cholesterol levels, and develop ways to handle stress and anger. Regular exercise directly and indirectly benefits your cardiovascular health and can help you avoid having a heart attack or stroke. The evidence comes from dozens of large-scale population-based studies conducted over the past several decades. As depicted in the picture here, there is so much evidence about other benefits than the cardiovascular health benefits of exercise. In fact, that physicians regard physical activity as a magic bullet against heart disease. These include neurological, endocrine, musculoskeletal, and oncological benefits. Most studies focus on various aerobic endurance exercises such as walking, running on a treadmill, biking with sufficient overload. It's been documented that strength training combined with cardio has additional metabolic benefits, with reduction in insulin resistance being the most significant one. One of the clearest positive effects of exercise is on hypertension. Many studies involving thousands of people have shown that physical activity reduces both systolic and diastolic blood pressure. These studies showed that people who engaged in regular aerobic exercise lowered their resting blood pressure by 2 to 4% on average. Lowered blood pressure itself reduces the risk of other kinds of cardiovascular disease. Fewer studies have been conducted on exercise and risk of stroke. Even with limited evidence, however, there appears to be a similar inverse relationship between physical activity and stroke. According to a handful of studies, the most physically active people reduce their risk of both ischemic and hemorrhagic strokes by up to 30%. Figure 11.6 from your textbook shows the strategies for reducing your risk of cardiovascular disease. And this infographic is a very good summary of what we should do more and what we should do less in order to improve cardiovascular health. Please review it carefully. And if we want to just take a look at some of the strategies to do more, we have already discussed those: being physically active, eating a heart healthy diet, and effective strategies to fight with stress and anger, and do less tobacco smoking, alcohol consumption, trans fats, eliminate them completely, and saturated fats, avoid added sugars completely, and excess stress, anger, and hostility. So that's all we cover for this chapter. Thank you for listening.